Morning, Rotarians and guests.
Yeah.
Is this thing working this morning?
Yes, it is.
Okay. Welcome to the Rotary Club of Hudson. Ron Strobel, Sergeant at Arms. Our invocation this morning is by David Basil.
Good morning, fellow Rotarians and guests on this balmy morning in the historic Western Reserve. Please join me. Eternal and benevolent God, when we focus on the minutia of the temporal and material, help us find the hope that enables a larger vision that extends beyond our own future. When we dwell on the narrowness of self-interest, help us find the courage to recognize our own limitations. When we are preoccupied with personal rights, help us find the wisdom to see the intersection of our liberties with those of others and with the obligations that extend beyond ourselves. And when we are tempted by the illusory catharsis of settling scores, help us find the grace to see that part of your divine being in each other.
Thank you, David. And now please join me in the pledge and the four-way test. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now the four-way test of the things that we think, say, and do. Number one, is it the truth? Number two, is it fair to all concerned? Number three, will build goodwill and better friendships. And fourth, will be beneficial to all concerned. And we have no singing today, so we're going right to our, well, sure, go right ahead.
I said that's because you've never heard me sing. I'm one of those people that my grandkids beg me to stop instead of asking me to sing. Good morning, everybody. I'm glad to see all your bright, invigorated, shining faces. If you can get yourself out of that nice, warm, toasty bed, once you get up, it's invigorating, right? Gets you moving. Gets you moving. Okay. This month, we're collecting socks and gloves for the Haven of Rest. Don't forget about that. I'll be taking a trip down there here at the end of the month to take everything down there. Hudson Rotary Foundation Board of Directors meeting today after the meeting. And Friday, we have a gala meeting at noon. Where's the location? Okay, at the Community Foundation. So, for sure, the people who are on any dedicated committee, but anybody's welcome to come and assist because there's as much help to be had as there is available. Okay. All right. I guess at that, I'm going to hand this over to, are you introducing our speaker today? Mr. Basil.
Good morning again. It's my pleasure to introduce our speakers this morning. They are Kelly Harvey and Lisa Horning. They are each registered nurses and with a Bachelor of Science in Nursing. They are accomplished business development professionals with a proven track record in occupational medicine, serving employers in the health and wellness arena, along with drug and alcohol testing. Kelly and Lisa have devoted themselves to building employer relationships throughout the business community by determining the needs of their clients in their quest to contain healthcare costs. Their roles at SUMA Health System are continually evolving with the fast pace of healthcare by helping companies navigate their way through the SUMA Health System infrastructure, serving as the partner in corporate health. With over 30 years of experience, their specialties include development of occupational health clinics, wellness programs, and on-site health services, including training and education. They are currently serving as the outreach arm for SUMA Health. They are continually providing consultative education for corporate clients on ways in which corporate health occupational services can help maintain a healthier and safer workforce. Their time at SUMA Center for Corporate Health has allowed them to the pleasure of experiencing the positive growth of their current occupational health sites from 1 to 5 clinics in the Summit and Medina County area. Please join me in giving a warm Rotary welcome to this morning's speakers.
Thank you. Well, good morning, everyone. Good morning. My name is Lisa Horning with SUMA Health System. And today we have Kelly Harvey and Jody. We're going to kick it off for you this morning. Again, thank you so much for having us. Kelly and I serve as a wonderful role to the community and to employers. And what we do is we reach into the community and we connect patients to the health system. So for whatever variety of services that someone would need, we make that connection, and we're here to answer and serve as a resource for you. So for instance, if somebody is looking for a primary care physician, we can assist with that. We have a brand new behavioral health facility that can connect people to counseling services, trauma, PTSD, a variety of different services. So we're very proud to serve in this role, and we hope that you enjoy this presentation today.
Thank you so much. And I'll just take a few minutes because we have a lovely surprise for you today. Jody Helderman, she serves as a wealth of knowledge and a wellness nurse for one of our corporate clients. So we're going to be turning this over to her in a moment so she can share her wealth of knowledge. But I did want to just quickly touch, because sometimes I feel it's nice to have a little bit of a snapshot, just an overview of SUMA Health. So if you wouldn't mind just flipping to that next slide, please, Noah. All right, I just wanted to kind of give you a snapshot of SUMA at a glance here. So obviously, many of you probably are familiar. We're a bit of a staple in the community. We have a total of 2 hospital campuses. We have one obviously in Barberton and then one actually in Akron. And so we refer to that at SUMA as the Akron campus. For those of you who have been in the community for quite some time, for a lot of people, it's still Akron City to them. We have 15 medical centers, 1 rehab hospital, 5 urgent cares, 4 emergency departments, and 20 standalone physician offices. And a lot of people also might be familiar, SUMA has an insurance plan that's known as SUMA Care. So some of you might be familiar with that as well. All right, next slide, please. So to give you a snapshot, obviously, I just wanted to put that picture of our Akron campus, our new tower. That's what oftentimes most of you might see off of Route 8. That sort of serves as our main entrance at our Akron Hospital campus. But right here in the community, some of you might be familiar with our Stowe-Kent Medical Center. We obviously have our Hudson Wellness Institute, as well as our Hudson. Next slide, please. And next slide. All right, and I just wanted to kind of quickly put that up on here. So in terms of SUMA's commitment to quality, you can see some that we have. We always like to just touch on that because sometimes I feel like we can be the best kept secret. So when you look at, for instance, neuroscience right now, we are #1 in the state of Ohio for neurosciences, and we all received an award for through Health Grades for America's 100 Best Hospitals. So just wanted to share that. And next slide, please. So without further ado, I would like to introduce Jody Helderman. Mentioned, she really serves as our occupational medicine wellness nurse. She's going to talk to you a little bit about prevention. She's going to share a little bit with you how we partner with employers. And I'm going to turn this over to her without further ado. Jody Helderman, thank you so much.
Thank you. Thank you, Kelly and Lisa. You can go to the next slide, please. And this is about our corporate health services that we do offer. And as you can see, there's many. When I saw this slide, I was just like, wow, We do all these services. I was amazed that we provide all these services for our employers, employees, and also for the community. Next slide real quick. This is just a little bit about myself, what my interests are. I have been a nurse for over 40 years. My passion really is to help others improve their health, well-being, and their quality of life. So as you can see, I've done a lot of variety of different things as a nurse. Right now, I am employed as an occupational health nurse through SUMA. So that is what I do right now. So most people, when you hear about that occupational health nurse, first of all, one of two things, they think, oh, she's a nurse. So she must do hospital nursing, bedside nursing. Or they hear occupational. They assume occupational therapist. So someone who is helping people with disabilities, but it's not that either. The AAOHN, which is the American Association of Occupational Health Nurses, defines my role as an occupational health nurse is for three things, basic: to promote health, to prevent injuries and illnesses, and to promote safety, all in the workplace. So that is what I do. Can you go back to the last slide, please? Okay, so in our corporate health office, I actually have several different jobs that I do. 2 days a week, I work in one of our corporate health clinics, and that is at the Barberton Corporate Health. And so we provide a lot of these different services. So say you know somebody who was injured on the job, or they're getting a new job. Maybe they need a pre-employment physical, maybe they need a drug test, maybe they need a hearing test, all part of what you would need to make sure that you are doing your job safely and that you can do that job. So you would come to one of our clinics, and then you would see myself. I might be doing your height and weight, your blood pressure. I might do your hearing test. I am a certified occupational hearing conservationist. I also might be doing your breath alcohol, which I'm certified in that. I'm certified in urine drug testing, and also in spirometry, which is pulmonary testing. So any of those variety of tests, I know maybe you don't understand what that's all about, but that is what my job duties are in a clinic. The other 2 days a week is the job that I really have passion for. I work at a local company in Uniontown, and I am their employee health nurse. So we do a lot of health initiatives. I do a lot of wellness. I do injury care. I do illness care. I do a lot of different things. But since we're talking about health initiatives, I would like to talk about health initiatives today. I'm going to talk about a couple of different things that I specifically do there at this company. The first thing that I would like to talk about is they have a health insurance incentive plan. I don't know if you were ever a part of that at a company, or if you still are, working, if your company provides that service for you. So there's 3 parts to this health insurance incentive program. So what the health insurance incentive program is, if you do these certain things, you will have money deducted from your health insurance, and that comes out of your paycheck. So that the incentive would be, yeah, I want to do this, but some people don't participate, but we do have a lot of people who do participate. We have close to about 200 employees at this. It's a manufacturing company, plant, and I'd say about 40 to 50 people will take part in the wellness program. There's 3 parts to this wellness program. The first is a tobacco form. The second is a physical that you will go to your primary care physician for. And the third is on goal setting, nurse visits. What we call it is nurse visits and health coaching. So the first part of it is a tobacco form. So if you are a non-user of tobacco, or if you're a user of tobacco, you sign that form and you submit it to me. So I manage this whole health insurance incentive program for the company. So those forms will come to me, which is a great opportunity. So say you're a non-user, great. Okay, I don't really have to do much, talking. Don't need to have a conversation because you're already taking care of yourself. If an employee turns in a form that they say they are a tobacco user, it is a great opportunity for me to sit down and have a conversation with that employee and talk to them about when you are ready to quit, please come to me. I have the resources. Let's sit down and have a conversation. So that is the first part of the program. The second part of the program is the physical. Now, the physical, they go to their primary care physician, and then they submit that form to me. On that form, there's like a couple check-off boxes. One of them is the doctor will say, or the provider will say, yes, they have done all their preventative care for the year. Second box is if they have any results, please give those results to the employee so that the employee can bring it to me so that we can then review all that. A great opportunity again. So when they submit that form, I can go over it. Hey, how was your visit with your primary care doctor? What did they say? Do you have all your preventative care? Have you done everything? For women, have you had your mammogram? Have you had your colonoscopy? Do you need any vaccines? Do you need a shingles vaccine? Do you need a pneumonia vaccine? Have you had your flu vaccine? Or are you up to date on your COVID vaccine? Blood work. They can bring in their blood work and we can talk about their cholesterol numbers. What does your doctor say about that? We can go over that because most people, it's a quick visit with their primary care doctor. I am blessed that I have the opportunity to be able to sit down with these employees to be able to discuss with them anything that they want to know about those results, on their glucose, their cholesterol, A1C. Maybe the physician wanted them to have a vitamin D blood test, anything like that. So it's a great opportunity that I get to have a conversation with the employee and then talk about what do you want to do about that? What does your physician say that they want you to do? Do they want you to stop smoking? Do they want you to lose weight? What exactly does that look like? So that brings me to the third part of the health insurance incentive program, and that is the health coaching goal setting. So in January, January is a very, very, very busy month for me. And we sit down and we set a goal. Now I could tell them, oh yeah, you need to lose weight. Oh yeah, you need to stop smoking. You need to exercise more. That's not going to work. It needs to come from them. And as we all know that we personally have to set goals ourselves, we don't want people telling us what we need to do. No, because you know what? We're not going to do it, right? So it needs to come from them. So we sit down and we talk about what they would like to do. So what does bring joy in their life? And I want to talk to them about what do they want to start doing, what they want to stop doing, or what they want to continue doing so that they are the healthiest versions of themselves. So it's a great opportunity to sit down, talk with them about their goals. Now, they do have to visit me at least 5 times a year. So it's like every 2 months that they come and visit me. They can visit me as often as possible. I have people who need their blood pressure checked, every week, twice a week, once a month, or they need their weight checked. So a lot of them then come talk to me. And the goal setting also, it doesn't have to be about physical part of something happening. It could be emotional, it could be financial, it could be spiritual, it could be something for their mental health. Because I really want to them to realize what brings joy in their life and what they can do to bring that joy. An example I talked to this one gentleman and he said, you know, I am so happy that I can be a really good provider. So what does that look like for him? What does that mean? Does that mean to have a better work-life balance? Does that mean to spend more time with his family? Does he have credit card debt that he has to work at? Does he have enough savings? Does he need to put more into his 401k? Is he taking advantage of that? So we sit down and talk about that, and then they decide what that goal is. Sometimes when we sit down at first, they don't have any idea, but at least we talk about it. You know, they go back, you know, to the job. They might think about it for next a couple days, another week, maybe a month, and then they come back and then we have another conversation. So those are the three things that I do with the health insurance incentive program. Again, they sign a tobacco form, they go see their physician, and we do the goal setting. Any questions so far? Okay. So another thing that I get to do is we have a wellness committee, which I started 9 years ago at this company. So we have 8 employees that are on the wellness committee with myself. Again, January is the busy time of the year because we just had our meeting last week, and we sat down and we decide what we want to do for the company, what we want to do for the employees for wellness. And it's just a fun time. They decide what the topics are, and then I create the programs. So this is an example, sorry, of our wellness challenges that we do. And if they do, we set these challenges. If they complete all 10 challenges for the year, they receive $200 in their pay at the end of the year. If they do 8 out of the 10 challenges, they receive $160. So the first one we're going to do is on stress management. We're also going to do one on nutrition, mental health, financial fitness. They also have to do all 4 of the movement challenges. And the movement challenges, either it's a step challenge, they're doing keeping track of their steps. And I do provide people that don't have like a fitness watch. I go and get some cheap pedometers so that everybody has a chance to be able to participate in the program. A lot of fun we have with the movement challenges because in September, we'll do a hiking and geocaching. Does anybody know what geocaching is? Okay, fun, right? So we also incorporate geocaching. Geocaching is like a treasure hunt that you find it. We use on your phone. You can put the app on your phone, and it's called just geocaching. And it has the coordinates of where these hidden treasures are. And they can be as small as a medicine pill bottle or as large as a big tub. So what you do is you pull out your phone and you look on your phone and say, hey, where's the geocache? It shows you where it is. And then you go and find it. And it's anywhere. They could be in a parking lot. They can be at a park. It gets you about 50 feet away. Have you ever not found one? Oh, you haven't done it, but you've heard about it. Okay. But it's a really fun thing to do. It's really fun for then the employees to do that with their families. And we also have a water challenge that we do. The company that I work at has a foundry, and a foundry is in the summertime, it gets really hot, over 100 degrees. So we have a water challenge because, again, my job is to keep everybody healthy, prevent injuries, make sure that everybody is safe on the job. So I want to make sure that everybody is staying hydrated. So our water challenge talks about, how to stay hydrated and maybe making sure that you're not overhydrated too. So they just keep track of how much they drink every day. And our first challenge, like I said, was on stress management. And it's just, I create these, sometimes I put like a little quiz, like myth and facts about stress, how to manage everyday stress, where to get help. I always make sure that I want to make sure to put in the suicide hotline, any where to call in case someone has any thoughts of suicide. That's so very important. And that number that was just changed. Does everybody know that? There used to be a suicide hotline number. Now you can either call or text just 988. So 988 for the Suicide and Crisis Lifeline. And then on the back, I just put like a few things that like what they can do for stress relief. And then they just check off what they want to do. And then they turn this form into me. So those are some of the things that I do for the Wellness Committee. We also have speakers that come, just like you have speakers. Pre-COVID, we had a lot more speakers because we have only one conference room and it's very, very crowded when you try to fit, 40 people in the conference room. We had a variety of speakers. Actually, last fall, we had someone come and talk about Medicare. And then for the stress management, I have someone coming to talk about how to manage their stress. And that speaker's coming like in the end of February, the beginning of March. So those are the things that I do at the company. We also do, I have to look at my notes, find them, because there's a ton of other things that we have done in the past. And I want to make sure that I tell you about that. So other things, we started a garden with the Wellness Committee and the employees there. We also have had the Red Cross mobile van come out for blood draws, for blood. We looked at our vending machines, how we could get healthier snacks in the vending machines. So we've done that. I actually do a quarterly newsletter for all the employees. The employees are also allowed to volunteer. So they're allowed to volunteer up to 8 hours a year. There's a process that they go through. I don't happen to do that, but they are allowed to go volunteer. We do set up times for them to come out to be able to go to the food bank. So we have a van that takes the employees to the food bank, and then they volunteer for 4 hours. We also have what's called a fitness discount also. So again, all these things that we talk about are promoting health, safety, and preventing illness and injury, which is part of, my role. So the other on-site services, besides those two roles, me working in the clinic and me working at the company, I also do other on-site services like speaking today. And also, if you look at the on-site services there's the mobile health unit. We actually go to companies and we will do hearing testing. We'll do physical exams. We'll actually have a team of people go out to these companies. And the last time I was out on the van, we don't do it, of course, in the wintertime because it's really, really cold. The last time we went out, it was in November I think it was November 1st, and didn't it snow Halloween? So the next morning, it was cold. It took over like an hour for that mobile health unit to get warmed up. But I felt really bad for the people getting physicals, but they didn't have to take everything off for their physical. They had to keep their clothes on. But the mobile health unit is great because we have 2 hearing units. And so I've done the hearing testing there. We will do vision testing, we'll do flu vaccines, we'll do EKGs, we'll do breathing tests, just a variety of things. We'll do blood draws, and then we will have a provider come out with us, and that provider will actually do the physical exam. So those are all for employees. We've also, though, used the mobile health unit for community things. So we've taken it to, like, Medina has a trunk and treat there at the SUMA facility, and we have the mobile unit there. We also participate in the Blue Tip Parade in Wadsworth, and the mobile unit is there. And we actually participate in the parade. And actually, I did that this year for the first time, and it was a lot of fun to do that. because you were able to be with your coworkers and share some joy and have a lot of fun with that. We also have taken it out to the community. We have a company that we have worked with for many, many years. And we go out and do their health risk assessments and do their blood draws and biometrics. And then we offer them a physical and we bring the mobile unit out to the company. And we have a provider that comes out from one of our medical offices, and that provider will actually do the physical because it goes through their insurance, private insurance, but everything else is paid for by the company. So we've worked with this company for, gosh, over like 9 years doing their health risk assessments. Does anybody know what that is, health risk assessments? Have you ever had that before? Okay. One person, but someone else doesn't. So a health risk assessment is a questionnaire that people will take, and it has like categories of like how many fruits and vegetables you eat, how often do you exercise, do you wear your seatbelt when you drive? So it's a list of a lot of questions, and then it takes a determination. We send it to the company and it analyzes it and then tells you what your risk is for having certain diseases. So that's what does that make sense? Okay. So that's what the health risk assessments are. So we have worked with this one company for many years, going out to do their health risk assessments, their biometrics, and the biometrics include vital signs. And sometimes we do their height, do their height and weight, but sometimes we do their waist measurement and their hip measurement, because that helps to see the percentage of fat in their body, which then tells us if someone is healthy or not as healthy. So once those health risk assessments go to, we work with another company that we use that for, and we do draw blood, and we do cholesterol testing. We test for thyroids. We will do prostate blood tests too. So we get all those results back. What's great about this company is that we actually add on the health coaching portion. So it takes about 3 to 4 weeks to get all those results back. And then myself and a couple of nurses, we will go out and sit with the employees and do the health coaching and talk to them again about what we need to look at, what these numbers mean. And a couple of years ago, we had an employee that did not have some really good results. And that employee had to end up going to primary care physician and then to a specialist and was diagnosed with cancer. I'd like to say that, I get to go back and see these employees year after year, and that employee now is in remission and doing very well. But she was very thankful. And I remember even the HR person was so thankful that we had provided this service, because not everybody goes to their doctor every year. And as we know, preventative care is very important. So that's just one of the cases that I like to talk about. We also have on-site nursing where it says /APPs. APP stands for Advanced Practice Nurses. So at some of it, we have 2 nurse practitioners that work at other facilities. We have one that works actually at Akron Children's, and she works kind of like in their employee health, like kind of like an urgent care. So she takes care of the employees at that hospital when they get ill. So they come to her and she takes care of them. And we also have another place that's out Rootstown area. I don't remember the name of the place, but there's a nurse practitioner that also works there taking care of employees. Of course, we also do flu vaccines. I've done that in the past. I've gone to companies in the past and provided flu vaccines. And we also did that with COVID. So we did that for the community too. We actually had one of our nurses actually drove the smaller mobile health unit and went to companies and provided the COVID vaccines to companies for the community. And also I was a part of the Barberton Community COVID administration. So that was a big, big undertaking that we did for the community there at Barberton. Any questions at all? Kelly has one.
Yes, yes. Oftentimes, Lisa and I, we will get questions from community members, and they talk about, wellness, as you mentioned, from a variety of angles, whether that's mental health or physical health. But the one common theme that we find is whether it's in the community or even in a workplace, someone will say, what are the most common wellness initiatives that you might recommend as I age? So like we might have an aging workforce, or individuals in the community will say, what might some things be that I can do? And I look at my age, I'm 54. So, what might some things that I might be able to do, or the group, or anyone that's listening to this educational session, in terms of prevention? Is there anything you might recommend?
Thank you. Of course, working with your primary care physician is very important, because the primary care physician can tell you as you age, they're going to recommend shingles vaccine. They're going to recommend a pneumonia vaccine. So you want to work with your primary care physician to see what kind of vaccines, or as you age, especially once you become Medicare, what do you call it? Available. I don't know when you sign up for Medicare, there's an exam that the physician it pops up actually in in the medical record for that patient. Have they had their Medicare physical? And that includes part of like the mental health, and also they test like for beginning like dementia, as some of us, start losing our memory, or we start losing our hearing. So that's another thing too, is I would recommend going to an ENT, an ear, nose, and throat physician, or an audiologist, and have your hearing assessed. Because it's good right now to have say you feel like you can hear very well, but it's great to have a baseline. And so as you age, of course, most of us are going to start losing our hearing, whether it be from having diseases as a child that can cause hearing loss, or if it's been noise-induced hearing loss. So does that answer your question? Right, right. All right. So I think that's about all that I had to talk about. Oh, just one other thing. Okay. So telehealth. I think that is the future, and we're going to see more telehealth. So a lot of companies have telehealth, say that you're not feeling well, but maybe you don't have to go to the urgent care. Maybe you can't get into your primary care doctor. Some of the employers have an app that you can put on your phone through their health insurance, that they can go through and talk to someone. Say that you just have a cold or a rash or something like that, and you really don't want to go to an urgent care, because it costs more money to go to an urgent care. It costs more money to go to an ER. So you can use this telehealth to call and be seen via like your phone, and be treated if you have any simple illnesses going on. So telehealth, we actually used a lot of telehealth, and we still using it for the COVID. So for our employees at SUMA, if they think they have COVID, we have a hotline that they call, and they talk with a nurse, and the nurse assesses them and decides if they need to, leave work, if they need to come in and have a COVID test done. And so we are still doing that. When I use telehealth is, again, there's a company in Talmadge that we worked with for many years, again, on those health risks. Oh, that's okay. The slide's gone. But those health risk assessments, we go to them to do their health risk assessments, again, their biometrics and their blood work. And then we do on-site right then and there, we would do their health coaching with all the employees. Well, we did about 50 employees on site, but they had about 21. I did 21 telehealth health coaching because these employees were field techs. They were in California, Washington, Texas. They were all over the United States. So I had to, I managed that program and set up. It took a lot of finagling because they were out on the field, say they were leaving their home and they were going to be gone for a week out in the field and out in the field outside. They were outdoors. So I was trying to coordinate when I could talk to them. So I did telehealth and I did that health coaching on like 21 individuals for that company. So I think telehealth is going to remain something for us with our health. So again, thank you. Thank you. That's all I have. Please, Kelly and Lisa, if you have anything else that you would like to add, that would be great. And I think somebody has do you have a question? Okay. I'm going to bring you the microphone. And this is Phil. Hi, Phil.
DoorDash, microphone, thank you. Hey, I drove by St. Thomas Hospital the other day, and I was saddened to see that it's all boarded up and the windows are boarded up. Can you give us an update on what's happening at St. Thomas Hospital?
Yes, it was. Do you, I know, do you have an answer for that at all?
Yeah.
Once the center of the Alcoholics Anonymous, I wonder-
Yes, yes. So I'm so glad that you bring that up. And so I can at least touch upon a couple talking points. If you would like, more expanded information, I can, definitely find that out. But I will at least share, what I know. As you know, St. Thomas has definitely been a staple in the community for many, many years. When you look at AA, we obviously know, that was born out of St. Thomas Hospital and just a lot of passion. One thing I would encourage all of you to do, and we have not touched on this, but when you think of those services, at St. Thomas, so we'll talk about like AA, addiction medicine services, behavioral health, right? That was really a big thrust of what was at St. Thomas. So what we have now is we have taken a lot of those services and we've actually moved them into what's called our Juvie Behavioral Health Center, and it's JUVE. I would really, really encourage you to look up Juvie Behavioral Health and really kind of see the facility. There's a wonderful virtual tour. But what I will share with you about that is they were able to take a lot of those amazing artifacts that were located at the chapel, and
Chapel.
they have done such a beautiful job of really honoring everything that was born out of AA. It's really kind of set up as, I'll call it kind of more of like a spiritual
Mhm.
chapel.
Yes.
But they have saved many of those artifacts, and
Good.
it's really hard to put into words unless you experience it.
It's amazing.
But it's really unbelievable. And it also shares a little bit of the story of Dr. Bob, and there's a lovely, lovely video. And then also when you look at just overall behavioral health, a lot of those inpatient services as well as outpatient services have also been moved to Juvie Behavioral Health. So if you're familiar with kind of our Akron campus and you think of Market Street, as you drive along Market Street, you will see that behavioral health front
Okay,
and
good.
center. Does that help answer some of
It
those
does. Yes,
questions?
thank you.
Yes, yes. And I'll tell you, when we talk about St. Thomas, there's a real passion, I think, in there for all of us. I know there was conversations that, SUMA has had with a lot of the community members. I think a lot of people had a lot of visions for it. And actually, from what I understand, Even though that building is quite old, in terms of, I think I'm using this term correctly, like a geothermal perspective, it's a very, very sound building.
Yes.
The unfortunate part about it is, we even found that, like, if a community member would say, come forward and say, we love St. Thomas, that is something, that I've heard SUMA would be very, very open to those conversations. But the problem is the expense of, and all of the facets that go
Yes.
into that. So I hope that helps your question.
It does.
But it is definitely such a staple and a lot of passion with that.
There's one other question I was going to ask you. One
Absolutely.
important component of mental health is grief counseling. Do you get involved in grief counseling?
I'm so glad you asked that question. Absolutely. And I would love to speak to that because that just happens to be really my huge passion. So let me tell you what we did at SUMA. We did something very, very special. I happen to work with a lovely individual at SUMA by the name of Shannon Blower. He happens to be one of our chaplains. And I can't say enough about him. What happened was during the pandemic, as we know, not only at SUMA, healthcare in general, and so many other people, right? During that time, it was a very, very stressful time, especially in healthcare.
Yes.
So we had a vision and we said, why don't we pilot and train a total of 15 grief recovery specialists that we can essentially kind of embed at SUMA. And our goal with that program, when we piloted it, we said, let's pilot it, but they trained us from this grief recovery standpoint of how we might be able to kind of reach out and really be that heart with ears for other individuals. So it's just as though we were talking, the great thing about it is at one point in time or another, we have all experienced stress, anxiety, mental health issues. So it's really taking that grief recovery concept and embedding it at SUMA and being a heart with ears. So what we're doing now and what we're really excited about is our vision would be if we could kind of take that concept, and we're working on that right now in terms of how we can really reach into our communities. That's huge. And I do know, for instance, that is, a passion. Like when we look at, you hear these terms, right? Trauma response, trauma informed, mental health, grief recovery. I know that, for instance, our CEO, Cliff, that's a true passion of his. It's a passion of Shannon, who really kind of spearheaded that program from a community perspective. But I also see where from a workplace perspective. So now that Jody has kind of shared, this is the value and importance of kind of what I do in the workplace, to take something like a grief recovery and really maybe look at embedding it. So, whether you have children, family, grandchildren, regardless of their ages, this is something that I'm sure as you hear this, you might even think to yourself, gosh, how might that benefit them, whether that's in their families or whether that is in their role in the workplace or for yourself. So thank you for asking.
Thank you so much for doing that.
I really
Outstanding.
appreciate that.
I have one employee who, just a quick story, I have one employee who was planning on getting married,
Mhm.
and we were all invited to the wedding. The day of the wedding, we got a call from her, and her husband, or her future husband, was diagnosed with cancer. And so we did all get together, but it wasn't for a wedding, it was for the funeral. And so mental health counseling for people who are going through grief is really an important thing. So thank you for doing that.
Absolutely. And I don't have to share this, with all of you. You probably know, but a big thing that they teach us in that grief recovery space, and I'm sure some of you can relate, we really break it down in terms of, what are some of those messages that we heard, right? Even going back as early as when we were kids, right? What are some of those messages? So when someone's going through something, right? There's no right or wrong way to grieve. We all grieve differently, but some of the messages that we maybe heard as kids were suck it up and rub some dirt in it. Or, right, we've got that fellow friend that is very, very, very well-meaning, right? But you're maybe hurting and you're going through a loss and they look at you and say, oh, I get it. I went through that too, right? So there's so many different messages that we hear when someone is experiencing that grief and loss. And so it really, really breaks it down. And I could stand up here and talk about it all day, but I really appreciate you sharing that about, yeah, thank you for that story. Yes, ma'am.
I don't know if you can answer this very quickly, but I think you've got a lot of emergency rooms out there. Some of them affiliated with hospitals, some in standalone, centers. How do we know where to go?
So I'm so glad you asked that. And I'll definitely speak to that and I'll let Lisa chime in because I'm sure she's got a wealth of knowledge to share as well. So when you look at, so let's kind of break it down and we'll look at SUMA, right, as a whole. In terms of our emergency departments, so I would envision the closest to you here would be our emergency department at our Akron campus, or again, what some of you probably still refer to as Akron City Hospital. So our Akron campus has an emergency department. Also, Riverton Hospital has an emergency department. And then our green location, which is in Uniontown, you can see it right off the expressway. That is another emergency department. And then in addition to those ERs that two of them, again, are attached to actual health systems. And then the one in green is obviously freestanding. In addition to that, we have urgent cares. But I think what you're speaking to is sometimes it might be difficult to even navigate, right? All that SUMA has to offer. In the event you're faced with a situation, how do I know what to do, when to do it? Or, obviously, if it's an emergency, we know the obvious, call 911. But if it's something to where, maybe you experiencing a situation during the week or on the weekend, and let's say you're like, gosh, how do I kind of navigate this? What some people aren't aware of is SUMA has what is called an access call center. And I can definitely make sure I get you the number for it. But essentially, an access call center is going to mean a couple things to you as community members. Number one, to your question, if you have a situation and you're like, I don't know where to go, I don't know where to navigate this, you can call, it's essentially like a 1-800 number, and you will be linked up to like a patient access liaison. I hope I'm terming that correctly. And that individual will be able to listen to your question. If it's, hey, where do I go? Or what's the nearest urgent care? Or does SUMA have, sleep medicine services at this location? Where can I find the nearest counselor? That person will be able to essentially point you in the right direction and navigate you. The nice thing about our patient access center call center is, let's say that, and I'm going to use my mom, for instance. So her physician is a SUMA physician. I have seen really kind of that whole internal workings of how we essentially can navigate a patient throughout the whole system. And we really take on kind of that overall team care approach. So my mom, for instance, would use SUMA's access call center, and she would call that 1-800 number and say, get a vision. Or I've experienced this little bump on my arm. I'm not sure what's going on with that. I need to get in contact with my physician. So at our call, we have the liaisons that can then also get what I would call punted up to our nurses, our nurse case managers. So if it's kind of a medical related question, you could, I guess I kind of almost term it as the concept of a sort of an ask a nurse line as well, right? So you've got the access point, but also the nursing component. And then what would happen is that person would share, I have this medical situation. They would ensure that they coordinate care, get a note to your doctor, but also navigate you. So maybe it's, hey, listen, I think we need to get you into our ENT, or, you know, I think we need to get a note to your doctor. Does that help answer your question? I would highly recommend, and we'll share that number with you. I would highly recommend making a note of it. I know sometimes when you say go on our website, that can be a little overwhelming, but I will make sure I get you that number, and I'll let Lisa add anything I may have missed.
Okay, no problem. So I guess there's a twofold answer that I would have. So based on a person's symptoms, so for instance, if there could be a risk of a heart attack or a stroke, the goal is to get you to a facility as quickly as possible. That's the ultimate goal. Unlike what sometimes people think, I always want to go to that main campus because I think the main campus always has everything that I will need there. Some people think that, and that certainly is true. However, when it comes to a stroke symptom, ideally you want to get to the closest facility as possible. All of our SUMA emergency departments are very seasoned physicians, seasoned medical staff. You're going to get top quality care regardless if you go to the main campus or one of our satellite facilities, if that helps. In the event that you go to a satellite emergency department and you're required to be admitted to the hospital, no problem. They will transport you and get you admitted. So I hope that that helps answer the question. Again, it's one of those things where we do have, you know, they ask a nurse, the telemedicine, we have our urgent cares. Do you have any specific example that we may help you further? Did that answer your question? Okay. I hope so. I hope so. Anything else? Any other question? Yeah, sure. I can share it really quick.
And again, if you just, you know, go on SUMA's website and put in our call center or access call center, but there's different numbers, but they all go to the same funnel, the same location. So the phone number would be 844-303-3331. So 844-303-3331. And again, if you're on our website, oftentimes it navigates you right to our call center from many specialties.
Okay, so that will, I guess, end our presentation for today. We have brought some marketing material for your review. We have a variety of different information up here for you. If you'd like to take a look at it, take a picture of it, that's perfectly fine. It gives preventative medicine screenings. So if you're 60 years old and you're a female, what type of preventative medicine should I take? If I'm 70 years old and I'm a male, so she has a variety of materials up here, and you feel free to take a look at those. And we thank you so very much. We hope that when you choose healthcare, that you always select SUMA Health. So we want to be your partner in providing you quality care. So I'll turn it over. Thank you.
Thank you, ladies. Thank you very much. If I could ask one of you, we have our weekly Rotabuck here, pay out $7 today, gang. So if somebody would pull a number for me, please.
Right. Okay. The number is 924-788.
Oh, Maryland's the big winner today. All right, since we had a winner last week on the marble, we're back to square one on that one now. So let's see if you can make it happen, Marilyn. Here's your payout. You're welcome. Okay, we're all filled back up. Not today. Not today. Thank you. Okay. We have no other business. There is the foundation meeting, don't forget. Thanks again to our speakers. We greatly appreciate it. Get out there, stay warm. Have a good day.